Good evening, all of you. Just confirming if I'm audible and visible. So welcome back again to Meded Clinics. So this is yet another session on Meded Clinics in dermatology. And in today's session, I will be discussing about infections, your approach to skin infections when it comes to your clinics, isn't it? Now, we have already done multiple sessions now in Meded Clinics. So we have already discussed about how should be your approach in the cases of autoimmune diseases, how should be your approach when it comes to papillosquamous diseases, in pigmentary disorders, etc. And today we'll be discussing a bit about what is a general approach when it comes to skin infections. I'm sure that all of you must have seen a lot of skin infections because skin infections, especially the fungal infections, like what we call as a ringworm and all, it's very, very common, isn't it? So in every OPD, you will be able to see multiple of these kind of cases. So what we will try to emphasize today in during our discussion today would be like what should be a general approach when it comes to all these kind of case presentations, isn't it? So this is the topic of the day, that is approach to skin infections. So we'll be talking about how you will be able to diagnose these infections, and also we will be also discussing about uh, what should be the management in general, because it is impossible to have a session of all the infections. Because when I talk about infections, what do you think? Like, what are the common skin infections that is possible? So let us first cut it down into few, isn't it? Like it can be either a bacterial skin infection, it can be a fungal skin infection, viral skin infections, parasitic infestations, or it can be mycobacterial infections like tuberculosis or even leprosy. And also, when it comes to infections, we also need to include the sexually transmitted infections as well. So this all together, it's a pretty big topic. Now, we will not go deep dive into all those individual diseases today, which is definitely impossible, but we'll see what should be the common approach as it, isn't it? Now, to start with, our learning objectives of the day is going to be the understanding the classification of skin infections, definitely based on the etiology. Also understanding the clinical presentations, the clinical features, what are the differential diagnosis and the approach. And we'll also see what are the things that you should keep in your mind and what are the investigations that we can do so that ultimately we reach out to a diagnosis and ultimately the treatment. Okay. And without taking much more time, let's directly dive into the cases now. Now, first of all, when are you going to suspect like a bacterial, viral, or fungal infection? Okay, I'm not including the mycobacterial infections and STIs as of now, but let us keep it generalized into bacterial, viral, or fungal infections. Because you know very well that whenever a patient would come to you with any plague kind of a lesion, and the patient is saying that I'm having it for a very long duration of time, that is how we start thinking कि क्या ये psoriasis हो सकता है या फिर कोई lichen planus हो सकता है or anything that belongs to the papillosquamous diseases and all. And pigmentary disorders also, the moment the patient comes to you, the patient is always talking to you about the color of the skin. कि थोड़ा hyperpigmentation है या फिर hypopigmentation है. So that is how you again categorize it कि हाँ ये pigmentary disorders हो सकता है, ये papillosquamous diseases हो सकता है. But how do you have to suspect when it comes to a fungal infection or a bacterial infection? Yes, med student, pus and abscess. So that is what you think ki haan, this could be a bacterial infections, right? So I agree with you. Whenever a patient comes with pus and abscess and all, I have few images also for you today. So now let's see. Rather than talking about all these things together, how about cutting it down into bacterial first, then viral, and then fungal? I think that would be much more easier approach for all of you, right? So now let's start with bacterial infections now. Now, bacterial infections, first of all, let us talk about when do you have to suspect a bacterial infection. Because most of the times these bacterial infections, don't you think that this would be having an acute onset, isn't it? So let me just write down that this can have an acute onset. So when a patient says that this appeared over my skin over the last 1 week, or it is having a very rapid spread as well. So in such cases, we always think कि हाँ ये कोई infection हो सकता है, and obviously this can be a bacterial infection as well. The second one is when we examine the skin, usually generally categorizing it, if the patient can present to you with what all other symptoms in the skin. Let me say that can a patient present with pain, like a patient of cellulitis and all can present to you with pain, right? And there can be some warmth, erythema over the skin, etc. So all these things like what you can imagine in cellulitis and all. And just like what med student just now told in the chat box, the patient can also have pus or discharge. All those things are also possible, isn't it? Very good. There can be fever. Excellent. So when there is systemic symptoms that is associated. So in systemic symptoms along with fever, what others would you like to add on? The patient can have some malaise, tiredness, है ना? Or how about lymph node involvement? कोई lymphadenopathy हो सकता है? Yes, that can also be present. So all these kind of features, this can be suggesting that the patient may be having some bacterial infection, right? So imagine a patient who's coming to you saying that I got this thing over my skin. It is just 4 to 5 days now, but this lesion over my skin is disturbing me a lot. How is it disturbing? Because the patient is having some pain. The patient is having some erythema, some swelling over the lesions. Along with that, the patient may also complain कि मुझे अभी बुखार भी हो रहा है, because there is now fever, there is now some lymphadenopathy, all those things. Now you start thinking like, chalo, this can be a bacterial infections. Now, when I talk about bacterial infections, now it is easy if we can break down few things in our mind. What are the common superficial bacterial infections? Sorry. Yeah. So what are the common superficial bacterial infections? Any idea what should be the superficial infections caused by bacteria? Any idea? Can we have some examples of superficial bacterial infections? Let's say that a patient presented with a infection, that is a pus forming infection, or some crusting over the face. That is going to be some clue for you. Some crusting over the face. To be more specific, golden yellow honey colored crust. What comes to your mind? This can be a superficial infection, like it can be an impetigo, isn't it? So this can be an impetigo. Sometimes this can be even more deeper. So when we go a little more deeper, it can be something like erysipelas, isn't it? So when the patient is complaining that I cannot move my lower limb and there is a high grade fever in the patient, then we start thinking about something more deeper, that is cellulitis. That is cellulitis, isn't it? That can be another possibility. Very good. Anything else? Some very deep infection where the entire layers of the skin is involved. जैसे epidermis हो गया, dermis हो गया, subcutaneous tissue हो गया, and then even this is an infection which can even go beyond into the soft tissues as well. So what is that? Very deep kind of infection. So this can be, hi, very good evening. So this can be necrotizing fasciitis. Necrotizing fasciitis. That is going to be another option. Now, how about some follicular infections, bacterial infections? So, what do I mean with follicle, which involves a hair follicle? Now, can you just make a guess कि कौन सा ऐसा bacterial infection है which can involve hair follicles, be it a single follicle, multiple follicles, and all? Just give it a try in the chat box. Just do some brainstorming now. कौन सा infections हो सकता है? Med student says it can be a carbuncle. I agree. Very good. That is one. Furuncle, very good, excellent. Now, before we go into furuncle, carbuncle, something else, little bit mild, that is an inflammation of an hair follicle. Inflammation matlab itis. Hair follicle means folliculitis, है ना? Boil. Very good, Binsi. So Binsi says this boil. So this can be folliculitis. हो सकता है. Or furuncle, as you have mentioned very rightly in the chat box, that can be one. Then it can be carbuncle as well. Carbuncle. So all these are going to be the common ones, right? How about seeing some of the images so that we will be able to correlate it better? So I'll show you some of the images now. Just see those images and imagine karo ki you are the dermatologist today in the OPD and you are getting all these patients today. And then seeing these patients, are you able to make out any diagnosis based on the clinical manifestation? And then we will talk about the investigations and stuffs. Now, let's talk about this image first. I'll just zoom this image for you. Now, in this image, what I can see is there is a child who is coming to you, and you can see that entire perioral region is having which color? When you see this, you're going to say what is the color of the lesion. So the color of the lesion here, to my eyes, it is going to be yellow in color, correct? So these are something that has dried up over the skin, and this dryness over the skin has ended up in a yellowish discoloration as well. So Kalai says that this is impetigo because the color of the crust is going to be golden yellow. Very good. So this is going to be non-bullous kind of an impetigo. So this is going to be non-bullous impetigo. So in non-bullous impetigo, what we can see is a golden yellow, honey colored crust, So that is what we can see, isn't it? So again, impetigo, it can be bullous impetigo as well, because when it comes to bullous impetigo, the crust would change in color. The crust would become brown colored crust or a varnish crust. That is how it is seen, isn't it? Now, that is how we have seen one patient now. Now, let us see one more patient. I'll just zoom this image again for your reference. Now, this patient has come to you and the patient is having some fever. The patient is having some fever. Along with fever, you can see a erythema over the face. So fever plus erythema over the face. Any diagnosis that comes to you with this typical clinical finding? Patient is having fever, there is some erythema over the face. Now we are examining the face very closely. So once we are examining the face very closely, I can see that it is a well demarcated lesion or the borders are well defined. So there is a erythema over the face with a well defined border. Chalo, I would love to hear what is your diagnosis in this case. Excellent. So this one is called as erysipelas. Okay, this one is called as erysipelas. So erysipelas is usually caused by streptococcus and the patient usually comes to you with fever, systemic symptoms. Along with that, when you get these kind of skin lesions, the skin lesions are having a well-defined border. That is how you can identify. So ये हो गया हमारा erysipelas. See अभी देखो impetigo was more superficial, then we spoke about erysipelas. It is little more deeper because it extends into the dermis as well. So now we will see one more patient. Okay, so one more patient where now this is a patient who has come to you probably with a bystander and the patient is having a very toxic look, like the patient is going to collapse now. Okay, the patient is gonna collapse, he's having a very toxic look and the patient says, I was completely all right till yesterday. Today when I woke up, I'm getting so much of fever, chills, okay, feverishness, all those things are present. And along with that, no other symptom, because you are asking, you're just auscultating the chest. You see that the everything is clear, the chest is clear, there is no issues anywhere, no sore throat, no cough, no breathing difficulty. But when you examine the entire skin, you can see that the patient is having a very erythematous, swollen, shiny skin. Now, what is your diagnosis? I've given you enough um, clinical features now. So Shiv says that the differential diagnosis should be between cellulitis and erysipelas. And Binsi says it is cellulitis. Kalai is also answering. So now, so this one should be very good. The answers are all right. So this should be a good feature of cellulitis. So what are the features that is in favor of a cellulitis here? Is because the patient is having fever, the patient is having chills, the patient is having inflamed skin as well, isn't it? So all these features, especially with this inflamed skin, the borders are vague. There are vague borders in this patient. So otherwise the borders are not well defined, like how it was seen in the case of a erysipelas. That is how you will be thinking that this is going to be a case of cellulitis. Clear? Now again we are going to see one more patient now. Now the next patient is someone who is screaming. Okay, all of a sudden we have a screaming patient in the OPD or in the emergency department, and the patient, the bystander, everybody is worried because the patient is coming again with a toxic look, high grade fever, and the patient is crying out of pain, very very severe pain, pain out of proportion to what you can see over the skin. Now, once you examine the skin, what can you see? You can see a gangrenous skin, right? So this is going to be giving you a clue that there is some serious infections that is going on in this patient, right? So that is how infections are presenting to you. Kyunki it is having an absolute different presentation from any pigmentary disorder, from any papillosquamous diseases and all, from any autoimmune diseases as well, isn't it? So यहाँ पे this one should be, yeah, very good, med student Binsi, all of you are answering. This should be necrotizing fasciitis. This should be necrotizing fasciitis because the patient is complaining of, again, fever. Along with fever, there is going to be severe pain where this necrotizing fasciitis can be seen. And this severe pain ke saath, what do you see in the skin? You can see a gangrenous skin. So when you see all these kind of things, we definitely are not going to settle this patient in our OPD, isn't it? From dermatology, it seems like this patient requires much more care because this is one case where it's not only the skin, but also the soft tissues underneath is also involved. Ab yahan pe, we are not going to take a lot of time with this patient because we want to do something in an emergency now. What should be the emergency management in this patient? We'll talk about investigations and all later. But is there anything that we should do in an emergency? Jaldi. Now, should we refer this patient to some other department so that we should do something? Because we are talking about what is this? Anything that you would like to add on? I would say that let's refer this patient to the surgery department. है ना? So Sandeep sir would take care of this patient. Kyunki why? Yes. So here what we will do is we will have to go for a surgical debridement. Surgical debridement along with a broad spectrum antibiotics. That is how we are going to deal with this patient. That is about necrotizing fasciitis. I'm doing great, Shiv. All good. It's raining. I wish it is raining in my place as well. It's pretty hot where I am. So now let's see one more patient now. So now we are seeing different kinds of presentation of bacterial infections. Now this thing is pretty mild. Okay, this will not come to any emergency department. Rather, this case will always come to our OPD. Sometimes patients do ignore as well. Now what is this here? I can see what is the primary skin lesion that you can see here. The patient is now complaining कि मुझे थोड़ा itching हो रहा है over the skin, and you can see that there is a pretty much localized lesion. And where is this localized to? It is localized near the beard hair and all. And you can see multiple, 1, 2, 3, 4. So multiple pustules can also be seen. So when it is a group of pustules, I will not agree with this herpes here. Why I don't agree with herpes is I'm having images of herpes as well. Because in a herpes, please remember, in herpes, the patient will always present to you with multiple vesicles, okay, fluid filled lesion. But these are not fluid filled lesions. These are lesions that is filled with pus. So that is why we call this one as folliculitis. Okay, so ये हो गया folliculitis. So how does the patient present to you with folliculitis anywhere in the body? Because folliculitis can be seen wherever you have a hair follicle. Like in the entire body, if you have a hair follicle, folliculitis can be seen anywhere. But this one is going to present to you with a group of pustules which is associated with some itching as well. So that is how a patient can present to you with folliculitis. And remember, the most common type of a folliculitis is called as folliculitis barbae. So what is folliculitis barbae? I'm sure the boys out here would be able to correlate it much better. Because every time when you use a razor to shave off the beard hair, immediately after shaving, you feel that there is some irritation to the skin, isn't it? And once there is an irritation to the skin, if you just closely examine in a mirror, you can see that there are small pustules that develop over the skin. That is exactly what we call it as a folliculitis. So remember, pustules anywhere together along with some itching, this is going to be folliculitis. This is usually caused due to Staphylococcus aureus, and since it is a superficial infection, we can use some antibiotic creams. अब ये बोलो, if you know the names of any antibiotic creams, because how are you going to take care of any case of a folliculitis which is considered to be a very superficial kind of a bacterial skin infection? Any answer for this one? How are you going to take care of a folliculitis? या फिर मुझे कोई भी एंटीबायोटिक टॉपिकल एजेंट्स का नाम बताओ. वेरी गुड. Mupirocin, fusidic acid, all those things. Excellent. So mupirocin, fusidin, etc. All those things can be used. Amazing. Great answers. Okay. So all these are going to be different types of bacterial infections. Now we have one more patient who's coming to us. Now this patient is like, your problem hai because I'm having a lot of pain that is localized to this site. And you can see what are the things that you can find here. There is some erythema, there is some swelling, and there is some single point like this here as well. Now, what is the diagnosis here? A very, very common kind of a presentation. The Shiv says that this is what we call as a furuncle. Does everyone agree with him? So what is this? So this one should be called as a furuncle. And the common name of which, yes, Himanshu is also right. This one we commonly call it as a boil as well, isn't it? So furuncle or boil. The moment you see this, you are able to understand कि हाँ ये एक furuncle है, and there is a or we call it as a boil. Now, what is the main meaning of a furuncle is that there is a pus forming infection of a single hair follicle. A single hair follicle. So that is how a furuncle would present to you. So once there is something like a furuncle, we know that pus anywhere in the body. Okay, pus anywhere in the body. What should be the treatment? Treatment bhi batao jaldi, because investigations and all will keep it for later. Abhi koi bhi jagah pe if you get a boil or a furuncle, which means there is a pus. So if there is a pus anywhere in the body, will you keep it just like that and give some antibiotics and ask the patient to come back later? Yeah, would you like to take a blade? Okay, Yeah, you will like to take a blade here, na? So because you are going to give an incision and you are going to drain off this pus. So here the treatment should be incision and drainage. So plus minus antibiotics. So this is going to be the management of this case of a furuncle. This is going to be the management of a case of a furuncle. Now we have managed so many bacterial infections today, and now you are feeling very confident. Now you are getting one more patient. Now ये patient आ रहा है आपके OPD में, and the patient is saying कि सर मैं diabetic हूँ, okay, and I'm diabetic since the last several years, and diabetes तो poorly controlled भी है. Sometimes it goes up to 350, 400. Sometimes it is like coming back to around 200, 150. So a poorly controlled diabetic patient. But this patient has not come to you for a management of diabetes. Now he's saying that there is something in my skin which is disturbing me a lot. Now, when you examine, you're seeing that the patient's neck region, the patient is having something like this. And you can see there is some raised skin, there is some swelling, there is some erythema surrounding the lesion. And when you closely examine, कि यहाँ पे एक छोटा सा openings भी है ना? ये जो sieve like openings can also be seen. I've given you enough clue now. Patient का history बताया, the patient का clinical presentation का description दिया. Now what I would like to hear from you is the diagnosis. Now can you tell me what is the diagnosis in this patient? Pyoderma. हाँ, pyoderma मतलब pus forming infection. चलो, but can you be more specific? Very good. Med student, Shiv, all of you are answering. तो ये हो गया carbuncle. This is going to be carbuncle. Why do I say that this is a carbuncle? Because how does a carbuncle differ from a furuncle? See, how it differs is that this is going to be a pus forming infection of multiple contiguous hair follicles. So multiple contiguous hair follicles is going to be a carbuncle. Okay? So again, since there is going to be a lot of pus beneath the skin, you again will have to go for an incision and drainage, and you'll have to treat the patient with some antibiotics as well. And as I mentioned you, this is very common in diabetic patients. So this is very common in diabetic patients. So these are different kinds of presentation of multiple bacterial infections. Okay. So what we have done till now is I just gave you few examples ki how can a patient present to you with impetigo, which is a pretty much superficial infection. How can a patient present to you with erysipelas? How can a patient present to you with cellulitis, necrotizing fasciitis, folliculitis, furuncle, as well as a carbuncle. So these are short glimpse of how a patient can present to you. So this is how what you will have to look for. What antibiotic you can use for furuncle and carbuncle? See, any of those penicillin group of antibiotics. Let us say we are using a dicloxacillin. Works well. Okay, dicloxacillin. All those things would work. Even amoxicillin, it works well. Azithromycin, it works well. Okay, all those antibiotics is going to work well for this kind of furuncle as well as carbuncle. And moving further, so now let's dive into some of the fungal infections now. Now, keeping aside these kind of bacterial skin infections, now when we go into a fungal infection, how is the presentation going to differ? क्योंकि अभी अभी जो हमने देखा था कि when the patient is having a bacterial infection, they usually come to you with different presentation. And most of those bacterial infections, they have an acute onset and rapid spread, and the patient would be having some systemic symptoms like fever and all. अब ये बोलो कि just think कि what could be the presentation of a fungal infection of the skin. What are the common presentation? इसका कोई acute presentation हो सकता है या फिर gradual onset. Usually क्या होगा, ये fungal infections का they have a gradual onset, है ना? So ये gradual onset हो सकता है, but what I mean to say is usually they can give you a more of a chronic kind of a lesions, isn't it? They'll tell you chronic lesions. Ali says that itching ho sakta hai, which I definitely agree. All those fungal infections, the patient can complain to you about itching, isn't it? So itching is going to be another one. And what else? When you see those lesions, how can the patient present to you? The patient can present to you with some annular, जैसे ringworm हो गया ना, round lesions, annular plaque lesions हो सकता है. That is going to be one of the presentation, isn't it? There can be some cases like candidiasis where the patient can present to you with some satellite lesions. So all these things are possible. Okay, multiple kind of presentations can be seen, isn't it? So when a patient is coming to you with a sort of chronic kind of a symptom along with some itching, localized lesion या फिर generalized lesion, then we'll think about कि हाँ ये fungal infections भी हो सकता है. So now let us break down fungal infections also. Now you must be knowing about different kinds of fungal infections. Now let us see what are the names of fungal infections. To make it little more easier, let us try to divide fungal infections into superficial mycosis and deep mycosis. Okay, that would help you to segregate it better. So can you name some of the superficial fungal infections of the skin? Superficial. I will not answer unless you answer me in the chat box. Okay, tell me about some superficial fungal infections of the skin. The superficial, the best clue I can give you is some ringworm jaisa. So what is that? Yeah, this can be tinea infections, or let us say dermatophytosis, what we usually call as tinea. See, in tinea can be different types. So I can see pityriasis versicolor in the chat box, dermatophytosis, tinea, all those things. Excellent. All those things are right. The tinea infections also, we name tinea infections based on the site of the lesion. अगर scalp में lesions है, तो we call it as tinea capitis. अगर face में lesions है, we call it as tinea fasciae. Over the beard area, we call it as tinea barbae. Over the hands, we call it as tinea manum. Over the groin area, we call it as tinea cruris. अब ये बोलो कि what do we call अगर किसी को tinea infections है, dermatophytosis, over the foot. Foot में क्या बोलेंगे? What is the name? What tinea dash? What tinea when it comes to the infections in the foot? पीड्रा नहीं, पीड्रा भी एक फंगल इन्फेक्शन है जो नोडुलर लीशंस ओवर द स्कैल्प हो सकता, ओवर द हेयर फॉलिकल्स हो सकता है. Yeah, that's going to be tinea pedis. Very good. Tinea pedis, isn't it? So that is how we call different types of tinea based on the site of the lesion. And just like what you have said, it can be pityriasis versicolor. That can be another one. So all these are going to be superficial fungal infections. Yes, Shiv, that is also called as the athlete's foot. Excellent. So when you are talking about athlete's foot, it reminds me to ask you कि ये जो टीनिया क्रूरिस है, जो which we can see in the groin area, टीनिया क्रूरिस को commonly कौन से नाम यूज करते हैं usually? What is the other name for टीनिया क्रूरिस? So yeah, so when a patient is complaining कि a lot of itching is happening in my groin area, I sweat a lot, or I have very laborious works. So because of that, it's causing me a lot of itching. So this is what we call as a dhobi itch, है ना? Dhobi itch, yeah, jock itch. Yeah, I got the answer in the chat box as well. Excellent. So now let's deep dive into some of those deep fungal infections, जहाँ पे implantation of the fungus because of trauma हो सकता है. So can you name some of the deep fungal infections that comes to your mind? So deep fungal infections में, yes, it can be rose gardener's disease like sporotrichosis. There can be chromoblastomycosis. Or there could be something which is called as the Madhura foot. That is called as the mycetoma. This is called as the mycetoma. And fungal infections are not limited to all these, क्योंकि जैसे candidiasis हो गया, so all those other types of fungal infections can also be seen. Now, yeah, coccidioidomycosis, I agree. Okay, penicilliosis, and so many fungal infections that can be seen. So now let us also see. Now let's come back to the OPD now. Okay, so now all you guys are the dermatologists in the OPD, and you are gonna see some cases now. So now let me just zoom in the first case for you. Now a patient has come to you saying that I got a very itchy lesion and this lesion is disturbing me. I keep itching over this lesion. Yeah, this lesion, it actually started something smaller. Now this lesion is becoming bigger. The lesion is becoming more wider. That is what the patient is complaining to you. Now, when you examine this lesion, we are taking a microscope, hand lens, isn't it? We are examining the lesion. Now when you examine the lesion, what you will be finding here is, ये जो lesions है उसमें जो scaling है वो peripheral scaling है. So this is going to be peripheral scaling. It's an expanding lesion. In the center, there is more of a clearing. Central clearing हो गया, peripheral scaling हो गया, the lesion is expanding. And overall, what's the shape of this lesion? Round lesion है ना, ये जो round lesion भी है. So tell me one name for this diagnosis. Who can answer? What do you see in the screen now? So this, based on the history, this should be tinea corporis. This is what we usually call as a ringworm, because the patient is complaining of itching and an expanding round lesion, an expanding round lesion. And very, very important finding that you can see in this patient is that the patient is having a peripheral scaling. So the patient is having a peripheral scaling. That is going to be one of a very important finding for you. Okay, so that is how you diagnose a tinea corporis. We'll deep dive into the investigations in some time. Now chalo, we are gonna see another patient now. So in another patient, ये जो patient है who is coming to you with the following complaints. अब ये patient का complaint क्या है? This patient is complaining of this patient is having a hypopigmentation. Hypopigmented lesions over the trunk. Now, this is a complaint of the patient. The patient is having some hypopigmented lesions over the trunk. But interestingly, यहाँ पे there is no itching. क्योंकि till this time we were like fungal infections है, so don't take it for granted कि fungal infections means it is always gonna itch. Wrong. Okay, this will prove you wrong in this case. So there is no itching, there is hypopigmented lesions over the trunk. Now what you can see is there is good scaling, and these kind of scaling, when you see the scaling, is a fine powdery kind of scaling, powdery kind of a scaling. Now what is this patient's diagnosis based on the clinical symptoms? Can anybody tell me what could be the diagnosis based on these clinical symptoms? Very good. Pityriasis versicolor. Excellent. So this is what is called as pityriasis versicolor. So in pityriasis versicolor, please remember the patient, the name of the disease is versicolor. So versicolor means there can be two different colors, because this patient can either present to you with a hypopigmentation, or the patient can present to you with a hyperpigmentation. दोनों possible है. So you should not be thinking in lines of any pigmentary disorders. You can always keep pigmentary disorders in the differential diagnosis. But यहाँ पे, this is more likely to be pityriasis versicolor. Okay, where no itching, the patient comes to you with a hypo or hyperpigmented lesion, and there is some scaly, and all these lesions are going to be scaly as well. Okay? So now let's see another one. Now यहाँ पे a patient is coming to you who says that मुझे एक लीशन यहाँ पे शुरू हुआ था और फिर ओवर द लास्ट सेवरल डेज और वीक्स ये जो सिंगल लीशन विच स्टार्टेड, अभी मुझे ना मल्टीपल लीशंस हो गया। तो अभी ये जो मल्टीपल लीशंस जो आपको दिख रहा है, तो all these multiple lesions that you can see here, this is now arranged in a linear fashion, isn't it? So these lesions are arranged in a linear fashion, and the suspicion that should come to your mind is that this is probably over a lymphatic spread. Can anybody tell me what could be the diagnosis if I give you one more clue saying that this is a typical presentation of a deep fungal infection? So this is a typical presentation of a deep fungal infection. So this one is going to be called as sporotrichosis. So this is going to be sporotrichosis. Very good, med student. This is going to be sporotrichosis. This is also called as the rose gardener's disease. So this is also called as a rose gardener's disease because the patient will come to you, initially will say that there would be a single nodular lesion, and this lesion has now become multiple nodular lesion, and which is now arranged linearly. Okay, this is going to be arranged linearly. So that is going to be the typical presentation of this condition, which is called as sporotrichosis. Clear? And now we will see one more case of a deep fungal infection. Now in this deep fungal infection, abhi kya ho raha hai? There is a farmer. Now this farmer is unable to walk properly. And when you examine, now you can see that this farmer is having a very large lesion. Kalai, yeah, in the histopathology, you can see splendor, Hopley phenomenon. Yes, asteroid bodies, the star-shaped bodies, all those things can be seen in sporotrichosis. I completely agree with you. So now let's see this. अब एक farmer आ गया, is not able to walk properly, and you can see that there is a very large swelling, है ना? There is a large swelling of the ankle of the patient, and in this large swelling of the ankle, I can see that there are multiple discharging sinus. There are multiple sinus openings, and from the sinus openings there are some characteristic discharging grains as well. I think this much of history is more than enough to make out a diagnosis. Hanji. So this is going to be Madura foot. So ये हो गया mycetoma, mycetoma or Madura foot. Mycetoma or Madura foot. So that is going to be, yeah, multiple discharging sinus, all those things, where a patient will have a large swelling. Along with the swelling, there would be discharging sinus, and not just the discharging sinus, along with that there would be discharging grains as well. There will be characteristic discharging grains as well. Or let us write here, there will be multiple sinus openings. Sinus openings and characteristic discharging grains. So because this one is going to be a deep fungal infection. That is about Madura foot. Now let us see another variety of presentation here. If you see that the patient is coming to you in this fashion, that the patient is having very itchy lesions in the body folds as in axilla mein ho sakta hai, like otherwise in this patient beneath the breast ho sakta hai. You can see that there is an erythematous lesion that is seen over the body folds, and the patient is complaining ki there is a lot of itching. Now what is this more likely? The patient is having itchy erythematous lesions over the body folds. So this one should be candidal intertrigo. Candidal intertrigo. Okay. Yeah, very good. Candida in the intertriginous area. Excellent. So intertriginous area, more than these kind of an image, you may get a patient who says that I'm a housewife and I'm getting a lot of itching in between my fingers. And again, in between the fingers, you can see there is an erythematous lesion with severe itching. That is also going to be candidal intertrigo. So any body folds, you get a itchy lesion. Think in the lines of a fungal infection, and this can be a candidal intertrigo. Now, what about the next image? Because in the next image is also a fungal infection. But in this fungal infection, what you can see here is that there is a whitish layer that is formed over the tongue or within the oral cavity. So what can this be? Uh, yeah, chronic paronychia. Yeah, paronychia, that can be a mixed infection क्योंकि वहाँ पे fungal भी हो सकता है and bacterial infection can also be there. And yes, there will be a loss of cuticle. I agree. So how about this image? मैं ये image की बात कर रहा हूँ. So now this image में you can see, if you want a history, if you want me to present this as a case, if there is a patient who has come to you around, let's say 20 years of age, and this young adult is saying that I'm asthmatic, and for asthma he says that I'm using steroid inhalers. Okay, so it's not just salbutamol, there is some budicort as well. So there's a steroid inhaler use. And the patient now says that over the last few days, I can see that there is some whitish lesion within my oral mucosa. What is this? Excellent. So Kala is answering. This is going to be oral thrush. So this is oral candidiasis, also called as the oral thrush. And this can be seen in which kind of patients? This can be seen in patients on steroid inhalers, or it can be seen in immunocompromised patients as well. Immunocompromised patients as well. Okay, so that is going to be another presentation. So these are different types of presentation of fungal infections. So what I want all of you to understand is, try to understand the kind of pattern, the different kinds of presentations of fungal infections, and start thinking on that lines. Okay, so now let's move into viral infections. Now, as we have done so far, when it comes to viral infections, let's try to first see what is going to, when are you going to suspect a viral infection, or how viral infections are going to have a presentation. Because viral infections, again, they can present to you with localized skin lesions, or the patient can present to you with systemic lesions, systemic symptoms along with skin lesions. So generally or broadly speaking, that is how a patient can present to you, isn't it? So let us talk about some of the examples of viral infections. So viral infections, like as I told you, what are the cases where a patient can present to you with localized lesions, localized skin lesions? Any idea? Yeah, rash and fever भी हो सकता है. Yeah, localized lesion as in let us say herpes simplex virus हो सकता है, isn't it? So a lot of different types of skin lesions. I guess it is more interesting, or you'll be able to correlate it better if I will be able to show you more images, right? Yeah, cold sore, very good. That is going to be herpes labialis. Well, now let's show you some of the images. That's going to be much more interesting, because if a patient presents to you with multiple vesicular lesions around the lips, what is the diagnosis here going to be? Patient says that I'm getting these kind of lesions, and I remember कि ऐसे lesions was present 6 months back also, because at that time when I had an exam I developed this one. Now after 6 months I'm getting this one, which means that these are recurrent kind of a lesion. So this is usually going to be a recurrent grouped vesicles near the lips. So in this case, what is the diagnosis? Yes, this is what we call as a cold sores, and these are called as herpes labialis. So this is going to be herpes labial. Yes, multiple grouped vesicles on an erythematous base. All those scenario, please think about this virus. That is herpes simplex virus. Now, at the same time, if you see these kind of grouped vesicles instead of lips, if you can see them over the genitalia. So grouped vesicles over genitalia. So now it seems like we are talking about a sexually transmitted infection, right? So what is this sexually transmitted infection where we can see a grouped vesicles over the genitalia? So again, when you see a group of vesicles together, think about the same virus, herpes simplex virus. So this is called as herpes genitalis. So this is going to be herpes genitalis, also caused due to herpes simplex virus. Okay, it is also caused due to herpes simplex virus. So now let's move into another case. Now this is another patient who has come to your OPD, and this patient is saying that there was a history of fever in this child. The patient had a history of fever 2 to 3 days back, and after the fever, the patient has developed a generalized rashes throughout the trunk. Now, in this generalized rash throughout the trunk, when you examine, there is a rash. When I just closely examine, I can see that there is a background erythema, and with this background erythema, there is a papule, or there is a vesicle or a papule. So different kinds of lesions can be seen. And when I just see, I can notice that there is one lesion here. This is a vesicle. So this vesicle, it looks like a dew drop on a rose petal. Now tell me the diagnosis. This is a child who had a history of fever, and after getting a history of fever, there is a generalized rash, and then in this rash you can find there is a vesicle which looks very beautiful, like there is a dew drop on a rose petal appearance. You drop on a rose petal appearance. Now, what is this going to be? Yes, this is going to be chickenpox or the varicella infection. So this is going to be varicella infection, which we also called as the chickenpox. And you will definitely treat the patient with some drugs like acyclovir, right? So Virender is right, 𝐒𝐿 is right, all of you are right. Okay, excellent. Now, what has happened is, after seeing a patient of chickenpox in the same family, somebody is coming back to you saying that now this is an adult, and this adult is developing a rash which does not cross the midline of the body. And not just that, the patient is complaining of severe burning pain. So the patient is complaining of severe burning pain along with the rash. So what is the rash looking like? The rash does not cross the midline, and this rash is having a lot of vesicles on erythematous base. अब ये बोलो कि ये डायग्नोसिस क्या है? The moment you see this, आपको कोई हिस्ट्री लेने की जरूरत भी नहीं है, because you can see that it is clearly over one side of the body. So it is along a nerve root or a dermatome. So what is this? In the chest and all, you will be like, the differential diagnosis can be a chest pain, isn't it? Yes, dermatomal means shingles or herpes zoster. Excellent. So this one is going to be shingles or herpes zoster, because what is happening in shingles or herpes zoster, because of the same virus, that is the varicella virus. When that gets reactivated, that leads to shingles or herpes zoster. That is how it is. Okay. And we will also see some of the other presentations of viral infections. Let's see about this one. If I just zoom this image for you, can you see that in this patient, the patient is not complaining about any pain here. Instead, the patient is saying that there are very rough lesions that I can see over my skin. These are rough verrucous exophytic growths. Now, what are these? What is the virus that is causing this one? So when you see these kind of lesions, will you think about herpes simplex? Will you think about a varicella? Yeah, you will just rule it out. You say that no, it is not herpes simplex, it is not varicella. But what is this? Yeah, Virender is answering. These are warts. Amazing. So these are warts which is caused due to human papilloma virus. These are warts caused due to human papilloma. Okay. Now let's see another one. Now this is now a child. Now this child is coming to you and you can see that there are multiple lesions like 1, 2, 3, 4, 5, 6, 7. Multiple lesions can be seen over the body, isn't it? And in this lesion, once you examine this lesion, the patient does not say any fever, कोई systemic symptom नहीं है, कोई itching भी नहीं है. The patient says कि this was one lesion, this has become multiple over the last 1 month or 2 months. Now what is this? Now why is this becoming multiple? Because one lesion becomes 2, 2 becomes 3, 3 becomes 4, 4 becomes 5, 5 becomes 6. Now this is called as a pseudo-Koebner phenomenon, which is usually seen in viral infections because more lesions do develop because of auto-inoculation of the virus. Now zooming this image, what I can see very clearly is every lesion is having a central depression. And for the central depression, we call it as a central umbilication. Now, what is the diagnosis here? Yeah, all of you are answering it right. Now, this one is a spot diagnosis for you. This is called as molluscum contagiosum. So, this one is called as molluscum contagiosum because you can find some papules here, dome-shaped papules with central umbilication. With central umbilication. The moment you see the central umbilication, you are diagnosing it as molluscum contagiosum. So you can see that there is a very, very different presentation, right? जब आप bacterial infection से fungal infections में आ रहे हो और फिर fungal से when you see these kind of viral infection, so all these diseases, they have a different presentation. It's so important that you see these cases, try to understand the presentation of these lesions so that you'll be able to have a right diagnosis. So now let's also talk about some of the parasitic infections, rather infestations, right? So when I talk about parasitic infestation, this also will have a very different presentation. And parasitic infestations are not too many, but every time parasitic infestations will come to you with a lot of itching and all. Okay? All those things, itching with nocturnal exacerbations and all. So now let's see what are the common presentations. It is always easy to learn with images. Now ये हो गया एक patient who is coming to you saying that doctor, I'm not able to sleep for the past several days because I'm having so much of itching in my skin कि by the time it's night time बिल्कुल सो नहीं पाता क्योंकि nocturnal exacerbation is there. अब ये भी प्रॉब्लम हो गया कि it's not just me who is having the itching, my family members is also having a similar symptom now. सब लोग का same complaint है कि there is a lot of itching with nocturnal exacerbation and same symptoms in family members, or let's say close contacts. In close contacts. Now, when the history is something like this, And when you can see that the in between the fingers, there is some kind of a lesion as well. Now, what am I talking about? I got the answer in the chat box already. So this is correct. So this is going to be scabies, where you can see burrows under the skin, isn't it? Burrows in the skin. So this is caused due to a mite, which is called as a Sarcoptes scabi, and this one is going to be causing a lot of itching. It can spread from one person to the other, and it's so important that you treat the patient as soon as possible. And it's not just the patient, we will also have to treat the close contacts as well, so that the spread is being controlled. Correct? Okay. And one more parasitic infestation what that we will like to discuss is about the females, isn't it? Those with long hairs, the whenever you get a very long hair, you start getting a lot of itching in the scalp. So once you examine closely, you can see that there is something that is moving, isn't it? So what are these lesions that is moving within the scalp? So what is the diagnosis here? This one is called as pediculosis. Pediculosis, isn't it? So in this pediculosis, what you find is you can find that there is some louse infestation. And you don't need a microscope here because this is so visible to your eyes. Yeah, this is a lice or a louse infestation. That is called pediculosis. So that is how these kind of parasitic infestations can also present in our skin, isn't it? So now once we have discussed all these things together, now let's see what should be our diagnostic workshop or workup for this skin infections. Because we definitely, when you see that the patient is having such a diverse presentation, what we have to do is when a patient comes, just take a nice history, do a lot of probing, you ask a lot of questions, try to understand what is the onset, how did the lesion start, and how does the lesions see present as of now. You have to also look very closely the lesions kahan pe hai, isn't it? So what is the site, what is the distribution, what is the morphology, all these things are important. And also make sure that you ask about some systemic symptoms, if any, like fever, and also ask if the patient is taking some medication. ये भी हो सकता है कि patient is diabetic, the patient is hypertensive, the patient can be having some other diseases as well. So take a very detailed history, that is very, very important. Okay, and after taking a detailed history, we also would like to do some lab test, you know. So what are the laboratory investigations that we can do? Now what you see in this image now, ये हो गया एक image of a test कि अगर the patient is saying I'm having a lot of itching in my foot, and the patient says that I play football every day and I'm having a lot of itching in my foot, I can see some scaly lesions in my foot, all those things, then we do a simple investigation like scraping over the skin. Now what is this investigation called as? Can anybody tell me in the chat box कि ये कौन सा investigation है which we do very, very commonly, especially when we are suspecting a fungal infection? So anyone in the chat box, please? So yes, this one is called as the KOH test. Okay? That is potassium hydroxide test. This is an investigation of choice in suspected fungal infections. Because when we do this kind of a test, what we can find is in a KOH test, you will be able to find sometimes fungal hyphae, like in dermatophytosis. Sometimes you can find pseudo hyphae, so like in candidiasis and all. Sometimes you can find hyphae as well as the spores, like in this image. Those long strands, these are going to be the fungal hyphae, and all those rounded things that you can see in this image, these can be the fungal spores, which like we can see it in diseases like pityriasis versicolor. So please remember, every time you suspect a fungal infection, rather than directly going for a management, पहले confirm तो करना चाहिए, isn't it? तो confirm कैसे करेंगे? आपको ये इन्वेस्टिगेशन कर सकते हो, which is called as potassium hydroxide test. Clear? So now, no, more than this, just doing a fungal potassium hydroxide test, you can also do a fungal culture, which will help you to confirm the diagnosis, isn't it? So we can also do this fungal culture to have a confirmation of the diagnosis as well. Now, other than this confirmation of this diagnosis, we can also do another investigation, and this investigation is by using this instrument. So what is the name of this instrument? Like, there is an instrument which we use. What we do is we turn off the lights of the room. So we'll make it darker. And in a darker environment, we turn on this instrument. And then we are going to look for any colored fluorescence from the diseased skin. Now, what is the name of this instrument? Very good. So this is called as the Woods lamp. Excellent. So this is called as Woods lamp because in Woods lamp what we can see is we can see some colored fluorescence from a diseased skin. The color can be red, can be green, can be yellow, and based on these colors we will be able to make out a diagnosis as well, because there is a chart which says that red color means erythrasma, isn't it? Green color means it can be tinea capitis. Like apple green or yellow can be seen in pityriasis versicolor. So based on that, we can make out a diagnosis. So this is another investigation which we can do in the cases of suspected infections. Now coming to bacterial, what are the investigations that we can do? We can definitely go for a gram stain, isn't it? We can go for a gram stain. Also, we can go for a bacterial culture to identify the organism, as well as to plan antibiotic therapy as well. Antibiotic therapy, because we'll be able to understand key to which antibiotic this organism would be more sensitive, isn't it? So we can do a bacterial culture and sensitivity test. We can also do a gram stain to identify whether it is any gram positive bacteria, negative bacteria and all. So this is another test which can be done to diagnose this bacterial infection. अब अगला हो गया one more investigation in Zang smear. Now, when do we do a Zang smear? We do especially in vesiculobullous diseases. So when a patient is complaining ki chalo, we have seen a lot of cases where there is multiple vesicles, isn't it? Today, for example, in today's session, you saw an image of multiple vesicles around the lips. What was that? Herpes labialis. Whereas you also saw multiple vesicles in the genitalia. That was herpes genitalis. You saw a child also who is having multiple vesicles over the trunk. वो chickenpox था. And also you saw a patient who is having herpes zoster. So let us say in HSV, in varicella, in all these cases, if you do a Zang smear. So what is a Zang smear? Zang smear का मतलब ये है कि if there is a vesicle, we are gonna de-roof a vesicle. We'll open a vesicle, we'll take up the contents of this vesicle in a glass slide. We are going to examine it under a GMSA stain, and you probably would be able to see some MNG cells, right? What is MNG cells? Yes, de-roof the vesicle, scrape the base, and apply GMSA stain. Excellent, Kalai. That is exactly how you do a Zang smear. Now, what is MNG cells? MNG cells means these are going to be multi-nucleated giant cells. So we can see multi-nucleated giant cells, and that is how you can also establish. And we can do this in multiple vesiculobullous diseases, like for example in pemphigus. Even though pemphigus is not an infection, there also we do the same test. Okay, that is like where you can find acantholytic cells and all. Okay. Thank you for responding. And in the cases of viral infections, we know that we can go for a PCR for viral DNA, because that is going to be a very highly sensitive test for HSV, varicella zoster, herpes, human papilloma virus, etc. And we can also do some skin scrapings. Why skin scrapings? Because skin scrapings like the 𝐒𝐄𝐝 test which we did, don't think that 𝐒𝐄𝐝 can only be done for fungal infection. जैसे scabies में if you do a skin scraping, you can see the scabies mite, isn't it? So Sarcoptes scabies can be identified. Pediculosis, you can see it with our naked eyes. Still, you can also examine it under a microscope as well. So in parasitic infestations also, we can go for this investigation which is called as skin scrapings can also be done. And finally, skin biopsy. Because why skin biopsy? Yes. Why skin biopsy? Skin biopsy, that is, this can be for the final confirmation of diagnosis, or this can be done when there is some atypical presentations, isn't it? So when a patient is coming to you with some atypical presentations, or let us say some deep infection like sporotrichosis, leishmaniasis, all those things, then we can also go for a skin biopsy and we can examine under a microscope for histopathology. Like earlier, you mentioned that you can see asteroid bodies, you can see copper penny bodies. So how all those things are seen? Then you do a skin biopsy and send it for a histopathology. Clear? So that is it. So the key summary of today's session is that when we deal with bacterial infections, so they usually present to you with some acute inflammation, isn't it? There can be some discharge, there can be a rapid spread, and there can be systemic symptoms. Whereas when it comes to fungal infections, they usually have a gradual onset and have a chronic history as well. And obviously there can be scaling, itching, and all these things. When it comes to viral diseases, and again they can come to you with vesicular eruptions, they can come to you with rough surfaced verrucous lesions and all. And parasitic infections can also be presenting to you with, so all together with itching. So all together this is going to be a very diverse presentation. So it requires you seeing a lot of cases, isn't it? Taking a good history, and more than anything, being a very good observer, isn't it? Identifying the type of lesions, how the lesions have evolved over the time, and what are the symptoms that the patient is facing right now, so that you can narrow down the diagnosis. And we have seen multiple investigation also. It is not necessary that you see a patient and directly say कि हाँ ये इम्पेटिगो है, ये टीनिया corporis है. बिल्कुल ज़रूरत नहीं है, because you can always go for multiple investigations which will help you to reach out to the right diagnosis so that you can do the right management. So I'm happy to take up any questions that you may have, because in today's session, what we have deliberately omitted is mycobacterial infections, sexually transmitted infections, leprosy, and all those things, because that will again complicate. I just wanted to give you a general approach to the common infections that you can see over the skin, and how you should be thinking as a good clinician. Okay, and please make sure that you explore more in the clinical corner in the app, because you can see so many different types of clinical presentations that is given. So just I hope that all these things will help you to be a better doctor, a better clinician. And if there is any queries, please feel free to inform me. And thank you so much for being a very responsive crowd today as usual, and I look forward to having more sessions with you again shortly. Thank you so much, and we would be in touch again.